This is breaking news.
Morning, everyone. My name is Dr. Ashwin Vasan, and I'm the New York City Health Commissioner. It's been a few weeks since I had the chance to speak to you as the city's doctor. A lot's happened over that time, so I appreciate you joining me this morning so I can share some updates about some of the priority issues affecting the health of New Yorkers. While they vary, there's a common thread linking many of the outbreaks and responses we've faced, which is that even when there's good news, there's no single hero of this story. It's truly a collective effort. The city's success in battling public health threats reflects the work of New Yorkers, individuals, organizations, community members, who leaned in and earned the hard yards of moving us all forward together. An area where New Yorkers have time and again made each other proud is COVID. As you can see on the slide behind me, we'll move the slides in a second. The current situation is good, but it's not permanent, and it could move significantly in either direction depending on the actions we do or do not take. This virus does not go down without a struggle, and our job is to maintain the upper hand. The winning combination to maintain that advantage is frequent testing, staying home, and getting treatment if ill, masking in crowded indoor settings, public indoor settings, and boosters. There's an updated bivalent booster shot that's better equipped to prevent infection from Omicron and many of its subvariants. To date, we have administered more than 360,000 of these bivalent boosters. To those vaxxed and boosted, New Yorkers, I say thank you. Your actions will help us blunt the force of any potential fall wave. It will help protect those around you and will allow you to enter the festive season with confidence. To everyone else, I say the time to get vaccinated is now. Pair it with a flu shot so we can also battle that seasonal virus. We're beginning to see influenza activity increase, so the time is now. We want nothing more than for all of you to celebrate a safe and healthy holiday season with your friends and with your loved ones. After nearly 3 years of uncertainty, we all deserve that. And the best way to make that a reality is to get your COVID and your COVID booster and your flu shot today. The city and the health department are urging New Yorkers to get their shots in ad campaigns, in media appearances, and through valued community partnerships, as well as through local neighborhood providers, which is where I got my booster and flu shot just a few weeks ago. Go to vaccinefinder.nyc.gov to make your appointment today, or call your provider or local community pharmacy to make an appointment. With our partners at health and hospitals, through Test and Treat, we are making end-to-end testing and treatment available throughout our city at more than 75 mobile sites, in addition to all 11 H&H hospitals and 57 outpatient locations. More than 60 million at-home tests have been distributed throughout the city since late last year, including schools, and we've got no plans to stop. Paxlovid supply is ample, so getting tested and treated might be the difference between 2 days at home or 2 days in the hospital. Getting tested frequently and assessed for treatment is a smart strategy going forward, whatever this virus throws at us. We're watching for any signals of an oncoming wave, and we continue to report indicators on our site, allowing us to track the status of this virus. But we also know that by the time a wave arrives, it's hard to slow it down. That's why an ounce of prevention really is worth a pound of cure. Let's not wait for indicators to worsen to take the simple, smart steps we can all take to have a safe and healthy holiday season. Get boosted, test and treat frequently, and wear a mask in crowded public indoor settings. Moving on to MPV, which is what the health department is now calling monkeypox. We have turned a corner that I hope indicates that we now have the upper hand on this outbreak. While I'm very proud of where we are, I'd like to offer our humility and gratitude for the current situation. The fact is there were real challenges. Scarce vaccine supply, a virus that was behaving in unpredictable ways, and there were technical glitches and mid-course changes to the method of vaccine administration that understandably led New Yorkers to frustration and questions. Yet when it mattered the most, New Yorkers did what needed to be done. And there are so many who have helped slow this spread. LGBTQ+ New Yorkers went to extraordinary lengths to protect themselves and their community. Community-based organizations engaged their networks to provide direct referrals for vaccinations and to share information. Bars, clubs, party promoters, and so many others worked with us to get the word out. And I'm immensely proud of this city and this health department's response. We consistently broke new ground and pushed forward our local and our national response, from being the first in the nation to expand vaccine eligibility and launching mass vaccination clinics, to developing innovative community partnerships and programs that have become a model for the rest of the nation. And while we cannot yet declare victory, the MPV campaign has been a convincing testament to the power of three core public health strategies: speed of response and a relentless focus on prevention, equity through community partnerships, and a commitment to and flexibility in working with affected populations. As I said, New York City was the first in the nation to launch so-called extended post-exposure prophylaxis vaccination clinics around Pride Week in June. And as we've learned with COVID-19, it's always important to get vaccine implementation right, but we must also get there quickly. Early doomsday predictions forecasted the persistent spread and endemicity of MPV in New York City and in the United States due to a slow national response. And because of New York City's persistence, we've turned that tide. From hope to ending one outbreak, let's look at another virus which we had eliminated: polio. This one's really personal to me. Polio is not a disease I first learned about in a textbook. I learned about polio from two of its victims, namely my father's older sister, a medical student who died of the disease in India in the 1950s, and my father's younger brother, a polio survivor who acquired the virus as a baby and who has lived for decades paralyzed on one side of his lower body. I remember very clearly the first time I met my uncle at our family home in Chennai, India, and asked him about his leg. I could not imagine facing such a challenge and was relieved to be told that I would not have to because I was vaccinated against the virus as a baby. But since I was vaccinated as a baby, we've seen persistent declines in childhood immunization rates during the pandemic and a suspension of global polio eradication efforts. All of this has contributed to poliovirus coming back to New York. And our surveillance has uncovered new information. While only one case of polio has so far been identified in New York State, ongoing wastewater surveillance testing provides evidence of repeated poliovirus detections in sewage samples in New York City. The latest wastewater results include an August sample collected in New York City from Brooklyn, Kings County, and an adjacent part of Queens County, tested by the CDC, that is genetically linked to the case of paralytic polio previously identified in Rockland County. While the information is new, the advice is old. Get vaccinated. Get vaccinated yourselves. Get your children vaccinated. Do it for your community. Do it for your city. And that's what New Yorkers are doing. Citywide, vaccination is up. It's being driven by infant and child vaccination, 0 to 5. As you can see, that's happening citywide. And as we've said before, wastewater surveillance does not tell us exactly who is shedding poliovirus, but our vaccination numbers do tell us who's at risk by showing communities that are lagging in vaccination. We're pleased to say that in communities where we identified vaccination delays, we are now seeing numbers accelerate. And when it comes to polio, there can be no hesitation, no complacency, and no delay. Get vaccinated and get your children vaccinated immediately. And keep the recommended schedule. There's absolutely no reason for delay, especially when polio's tragedies, like those that my family have faced, are entirely preventable. I've been on this job since March, and there's been a lot we've faced together. All of us have learned to expect the unexpected. We've learned to live with degrees of uncertainty, and especially when the information available to us is incomplete. But we've also come through a lot together. We've made individual and collective sacrifices on behalf of our fellow New Yorkers, most of whom are strangers. Because at the end of the day, whatever we think about public health, we all want to live healthy and long lives, connected to one another and to the people we love. This is the essence of our work and why we do what we do, so you can live your best lives possible in this greatest of cities. This job, much like battling an outbreak, will humble you. And it's with this humility, as well as with an immense amount of gratitude, that I offer 8.6 million thanks to the people of this city for helping us get this far. So thank you, and with that, I welcome any questions you might have. Hi.
So, I mean, are there any predictions for the holiday season in terms of coronavirus? Because we saw Omicron, we didn't see it coming last year. It kind of ruined the holidays for everyone. What are you seeing? What are your thoughts? What can we do about it besides what you've already said?
Yeah, the solutions are clear. The tracking is something we've been doing for years now. And often we're looking to Europe because historically we've been about a month behind or even several months behind what Europe is facing. And so we're watching those upticks in cases in places like the UK, Germany, and otherwise carefully. But right now, we're not seeing any new variants of concern here in New York City. But we're definitely watching that carefully. We would not be surprised if there is an increase in transmission into the winter, which is why taking these steps now, before we see increases, is the best way to blunt that. Well, it's certainly concerning because what we know now is there is a circulating, clinically relevant polio virus that can cause paralysis because it's linked to a case of paralytic polio, which I think should be entirely intolerable to us as New Yorkers and to us as Americans. So for that, this gives us an opportunity to make that message even clearer than we already have. But as you say, the strategy doesn't change. It's boots on the ground, community engagement, education, information, ensuring vaccine supply, and really doing the often invisible work of public health, which, as you can see, is beginning to deliver results. Well, we're always testing. We're testing frequently. The sample, as we reported, is from August. As you can see, it took us a while with the CDC to actually sequence it. And so, we're going to continue to monitor this. We have 12 watersheds across New York City. They cover really big areas. So they don't really tell us who's shedding or where exactly the virus is. It tells us, when we correlate it with vaccination rates, it tells us where do we need to target our efforts, what geographies, what zip codes, what places, because that's really what's driving our response. That's the risk. That's why we want to make sure that everyone's getting vaccinated. If you were educated elsewhere where polio vaccination wasn't required of you to go to school, if you sought an exemption of some kind to getting vaccinated from polio and you're an adult, or if you're a parent who has delayed or has failed to get their children vaccinated, now's the time. We're going to continue to advocate for resources. We're going to continue to work with our partners in the Biden-Harris administration and FEMA in particular around testing and testing reimbursement. At this point, we have no plans to stop ordering and to stop testing, but as we've been raising the alarm since the spring, the lack of congressional authorization for additional emergency funds, specific emergency funds for COVID, is certainly concerning.
Talk a little bit
mean, I think everyone's tired of COVID. So we've been dealing with this for nearly 3 years, and that's an understandable feeling. It's also a new condition to us as well as MPV. So that's adding to all our already, you know, our understanding of what we need to do to protect ourselves in terms of routine immunizations. But eventually we will get to the point where we're treating this as the annual or seasonal vaccine that it is when it comes to COVID. We don't talk about flu fatigue. We encourage everyone every year to go get their flu vaccine, and I think we'll get to that same place where we will develop a routine schedule for updated COVID vaccines that people should get routinely in order to navigate what we hope will be a seasonal condition going forward.
Because the monkeypox situation has gotten better, are you going to scale back that operation? And, I mean, are you ready to pivot if there is another COVID strain to boost the effort for COVID instead around the holidays? And also, because there's no federal funds coming in, are you going to continue at the same level with the COVID response?
Yeah, I mean, there's a lot of things embedded in your question. That's okay. No, it's the right question, because all of you and the people you represent, the people you're reporting to, the New Yorkers, 8.6 million people want a fast, strong, effective, responsive public health system. And frankly, we haven't even been able to catch our breaths from COVID to have that conversation about what's going to be required in terms of federal investment into that system. Because as we've seen and has been widely reported, we have a lot of work to do across this country to build a stronger public health response and a permanent public health infrastructure that can do exactly what you're describing: turn on a dime when there's an issue, scale up and scale back according to rates of disease or risk, and really partner with our routine healthcare system. We're channeling so much more of this response through our routine healthcare system, which has its pluses and challenges, of course, in terms of access to care, insurance, and reimbursement. So we've got to have that conversation sooner than later as a country, and we're certainly thinking about these issues as a city. Well, polio vaccination is required to go to school in New York City. And so our expectation, public and private, both by the city, by the state. And so our expectation is that every single student, when they hit school age, has completed their polio vaccination series. And that's been the case for decades, that as many as possible are vaccinated. We let the data drive us, and so when we look at 0 to 5 vaccination rates, we let that guide us as to where our boots on the ground efforts are most valuable. The work doesn't really change because we look at a zip code and we say, let's engage anyone and everyone in that zip code: providers, parents, schools, community leaders, community organizations. Let's talk to them. Let's bring education materials. Let's do tailored media efforts in whatever languages are necessary to get the message out. And that's what we've been doing, not since this wastewater sample turned positive, but since the initial case was detected in Rockland County. Those efforts have been underway in our city, and that's with great credit to this health department.
The 0 to 5 rates, is that just for polio, or is that for COVID vaccines or vaccines in general?
Say more.
You said that the rate was going up.
Oh, that 9% number citywide is polio specific. Yeah. Yeah. Yes, the vast majority of people do not need a booster. If you have no immune compromise, if you've got no other co-occurring conditions, your childhood vaccination should protect you lifelong.
Oh, just the booster, the bivalent booster. What did you say, how many people? 360,000?
Correct, yeah.
Out of 8.6 million. I mean, that's a low percentage. What are your thoughts on that and getting more people boosted, especially with this Omicron-specific booster?
Yeah, we have to do more. We have to get out there as a city, as a country, to get these boosters widely adopted. There is vaccine fatigue, and we're combating that, which is why we're, one of the biggest critiques of the COVID vaccinations over time, because we've been using the original formulation, has been that I'm fully vaccinated, I might even be boosted, and I got sick. Because we now have an updated version, in the same way you'd update your iPhone or update any technology, we've updated it to cover the dominant Omicron strains and its subvariants. If this is widely adopted, we should also be able to blunt transmission in addition to protecting ourselves individually and locally. So that's the message to New Yorkers. It's, you want to go back to your everyday lives. You want to do so with the freedom of mind and the freedom of purpose to congregate, to celebrate, to have a great winter and holiday season. Getting boosted now is your ticket to doing that. Whether or not you're doing it for others, which is our message, has always been our message. Do it for yourselves, but do it for others as well. This is your ticket to doing whatever you need to do and to celebrate healthy and safe into the winter. And just to be clear, it's only for ages 12 and up. So it's not all 8.6 million New Yorkers eligible yet. Okay, thank you.